Welcome to episode 31 of Travelling Science. G'day legends, welcome back to Travelling Science, the podcast that's sharing science with the world. My name's Jesse Crow and I'm the Travelling Scientist, coming to you today from Templestowe in Melbourne, Australia. And here on this podcast, we interview doctors, researchers and experts, hearing their stories and sharing their ideas that can help us to live smarter, happier and healthier lives. This week's guest is Elyse Zandegu, a myotherapist and remedial therapist. Elyse helps people with all sorts of health issues, such as neck strain, disc issues, soft tissue injuries, MS-related problems, lipodema, and all sorts of other pain problems. And she loves empowering people to understand their injuries and help educate them about their conditions and how they can improve their overall health. During our discussion today, she's going to answer questions such as, what is myotherapy? Why do we feel pain? How can we manage that pain? What you can do to prevent injury in the first place, and when you should see a myotherapist. And we'll also be discussing things such as muscles, neck pain, shoulder pain, back pain, endometriosis, lipodema, myotherapists versus physiotherapists, and dancing. So if that all sounds interesting to you, get excited to hear it all from the incredible myotherapist and remedial therapist, Elyse Zandegu. Welcome to Travelling Science.
Thanks for having me.
That's all right. Thank you so much for having me here in your lovely parents' home.
You're welcome. It's much better than my homes.
So we can chat all about what you do. Yes. And let's just get straight into it. Would you like to explain what exactly is myotherapy?
We get this question all the time because I think there's like a lack of awareness about like what it actually, I think people know what it is, but they don't really know what it is, if that makes sense.
Yeah.
So yeah, with myotherapy, myo is obviously the Greek word for muscle and therapy is therapy. So you got muscle therapy. So we utilize the muscles and influence them to create better outcomes and less pain for patients, and we can utilize tools like dry needling, like PNF stretching, MET, MLD, like all these different techniques we can use to get people out of their pain.
Needling, PNF, MET, MLD, it's a lot, but don't worry. These will all be explained by Elyse shortly. Basically, they're all techniques that can be used in myotherapy to reduce one's pain. So I had to ask, what's the deal with pain?
Why do we feel pain? Is there like a super general reason that we get pain in the first place?
There's a lot of reasons why people feel pain. It can come down to lifestyle factors like smoking and drinking and all, the inflammatory type things. And then there's also a lot of, I guess we're in an epidemic now, I guess, where we're sitting a lot more, we're more sedentary, and that obviously has its impact. And then you've got like the other side of the spectrum of people overdoing everything creates issues as well. So there's a lot of different factors, but when you're in pain, it's sort of a vicious cycle, because when you're in pain, you want to move less, and the less you move, the more pain you're in, and then it's sort of, it's becomes a very vicious cycle, and people become quite disassociated with reality when they're in so much pain. So that's where we come in to sort of bring them back down and say, hey, you're okay, and this is the plan. And
I know it's counterintuitive when you are in some sort of pain, you think, I should rest to try and help this heal. And
totally.
That's correct in certain situations to a point.
Yes.
But eventually you need to get back to movement, back to normal life. And
yeah, that's right. And there's a fine line that you walk between with anything like, rotator cuff, lower backs, because you need to move, but there's a certain criteria that you have to meet to sort of move to this exercise or to this exercise, because like you said, people want to rest or they do nothing, and that's worse than doing too much. That's why it's really important to work with a practitioner step by step, because I think if you self-guide it, you just end up miserable, and you make the process much longer than it needs to be with an injury.
Cool. So people are feeling pain and they need help, and they come to see a myotherapist.
Yeah.
What do you do day to day? Like, how are you helping people with their problem?
Well, I guess my role is very, very reactive, because I have people with different issues, so I sort of have to respond to what issue they give me. So on any given day I can see someone that's got a rotator cuff tear, sprain, strain, and then, you know, I've got, you know, lower back disc problems that I work through with people. I actually just had a really good friend of mine do her disc for, I think, the second or third time, so we had to, you know, work and then build it back up, and she's all good now. She's in a really good place now.
Yeah.
But then, you know, I've got like the sort of like soft tissue injuries and spinal injury sort of side of things, and then you've sort of got like the autoimmune side of things, which is really interesting. So you got like the lipodema, MS, which is, you know, really, really important to have a good myotherapist in your team for that.
Just a few explanations here. So MS stands for multiple sclerosis, which is a condition where your nerves start to break down and it becomes difficult to coordinate how your body moves. Super annoying and very sad. Also, lipodema is something we talk about later in this episode, but it's basically an abnormal buildup of fat cells in the body. And also, your rotator cuff is in your shoulder. So if somebody injures their rotator cuff, it means they've ruined their shoulder, probably by doing something silly like slipping in the shower or taking sports way too seriously. But myotherapists can be super helpful for all of these conditions. Now, back to MS.
Because, yeah, my MS is obviously quite a debilitating condition and can make your muscles like super, super tight because your nervous system's just going haywire. And so to have a, you know, regular treatment makes or breaks your outcome and your quality of life, especially. And then, you know, you've got post-pregnancy or, you know, during pregnancy. I also see patients that come to me pre-pregnancy just to get their body really relaxed, because massage obviously induces oxytocin and it helps re-regulate your HPA axis as well. So calms your nervous system down and, you know, makes you like in a better state of, you know, health and well-being as well.
Remember that oxytocin is also called the love hormone because it decreases stress levels and promotes feelings of positivity. And the HPA axis, that stands for the hypothalamus pituitary adrenal axis, which are three important parts of your body that control the release of various hormones. So essentially, massage triggers the release of positive hormones that can help with healing. And I know what you're thinking. If I go see a myotherapist, will I get a massage? And the answer is yes. Yes, you will.
Is massage a big part of it? Is that something...
Oh yeah, like clients like want to be they want to have that hands-on approach. Like I think that that's where myotherapist is so awesome, is because we have the hands-on approach, and when people come to you in such crippling pain, they just want to be touched and just, you know, have that like circuit breaker of like, let's just stop the inflammation and the pain. Yeah. Because, you know, I've got and that's what we do at our practice. You know, physios across the board and myotherapists across the board at our clinic, that we're all hands-on, and that's what that's sort of like a POD, like a point of difference is. Because we're hands-on, that's why people come, because they want to feel like they're getting that service, and walk away feeling better, rather than just, you know, going to another clinic and being given exercises and a TENS machine and then sent on their way. And that's because it's not really what almost responds well in my experience.
It's almost like those people might be saying, "Oh, yeah, here's what you should do. Go home and do it yourself,"
you'll be right.
kind of thing. You'll figure it out. And then most people, what do? They go home and they don't do it for whatever reason. They don't want to, or they can't be bothered, or they forget, and then it gets worse, and then they think, oh my gosh, nothing's going to help me, and then that's when that it drives further down into that sort of spiral. I'm not saying that like TENS machines and rehab certainly have their place, but I think like a massage is sort of an integral part in that sort of healing to get to where we want the clients to be. You mentioned physiotherapist there.
Yes.
What is the key difference between what are the differences between, say, myotherapy and physiotherapy? Because at first thought they kind of sound similar?
I think there's a lot of like blurred lines between them, but I think that they each have a really good place. So physiotherapists deal a lot with more like with post-op, complete knee rehabilitations or hip. I find that they're really, really integral for that. I especially find them really beneficial if someone's got like a very complex spinal injury. I'll send them to the physio, and then we can sort of toggle back and forth. Whereas myotherapists are a bit more muscle, I would say a bit more hands-on than the physio. So physios are probably like, I'd say maybe like 20% massage and 80% exercise, whereas myotherapy is probably 80% hands-on, 20% exercise. But both are really important, and some people really need both to be in their team in the initial stages at least.
I can imagine there's plenty of situations where physiotherapists and myotherapists would work together on certain treatments.
Absolutely. Like I've a few of my MS patients actually will have their physio once a month, and then they'll come to me every fortnight, and it works really, really well for them. And even patients, they say, I actually want to do physio once a month, and I'll come to see you every 6 weeks. I'm like, whatever works, because at the end of the day, you know your own body as well. Yeah. So we work with them and go, sort of give them ideas and encourage them. This is probably what you should be doing, and then they can collab and say, oh, this is what works for me. And we say, brilliant. You do you.
Oh yeah. You mentioned before some techniques. I think you said needling, and then there was a few compressed words that I didn't even understand.
So we've got, I'll try and like list all of them off the top of my head. So we've got needling, obviously.
Just quickly, like, what is needling and how might that help?
Yeah, so needling is probably like my favorite tool that I use, and I think that's like my therapist like thing. There's like they really know how to do needling properly and really effectively, because that's a lot of the course of the myotherapy component is the needling. So needling was introduced originally by a woman named Bonnie Wright, and I love that it's by a woman. And she was actually a sports therapist, and she was actually injecting saline with the needles into athletes' muscles, thinking that it was the saline that was releasing the muscles. So basically, you're creating a controlled wound. So when you create the controlled wound, you're going to have that inflammatory response, and you're going to lay down new tissues. And I love this word, fibroblasts. You're going to lay down new fibroblasts and new tissue.
Fibroblasts are structural cells that are super important for repairing damaged parts of the body. And we talked about them with immunologist Kellen Cavagnero in episode 16 on autoimmunity. But why needles? Why do we need to get stabbed before we can heal?
It's almost like a reset of that muscle when you put that needle in, because it sort of goes, oh, okay, I need to like start the healing process again.
Yeah.
Basically, Bonnie Wright discovered that saline wasn't what was making that response happen. It was actually the needle itself. So that's when dry needling came into play rather than injecting something in.
Right.
So you've got that.
Yeah.
You've got MET, which is muscle energy technique,
Okay.
which is basically like a very gentle stretch and kind of like tricking the body's like brain and nervous system to get more range. So you're pushing the body against itself really, really gently, and then you're releasing it and stretching it. And it actually works really well for people who've got really, really stuck necks, even backs and hips. Like it works really, really well for that. And then you've got PNF stretching as well.
PNF, what does that stand for?
So PNF stands for proprioceptive neuromuscular facilitation. And that's more like what the athletes do to get like a lot of range. So that's like pushing like 80% capacity to get more range. And that's what you would do. Certainly wouldn't do that before a game. You do that after a game because you don't want to induce tears. What else do we have in our toolbox that we can use? We've got MFR, so myofascial release technique. So that's where we're using the fascia on someone's body and like really stretching it out.
Mm-hmm. You mentioned fascia a couple of times. That's some sort of like muscle
yeah
tissue?
So it's the muscle tissue. It's the muscle tissue that you can influence to be a certain posture or move a certain way.
Yeah, very cool.
Yeah,
I like that. It sounds like you got a whole like you said, a toolbox
yeah
different things you can use depending on the condition. And
absolutely, yeah. And it's a wealth of knowledge, but it's like I wish like someone could like put a USB in you and just like download all the information, because it's so much information.
Yeah,
I guess that's what makes it really cool, is that someone can come to you with whatever and you go, right, I got this. I can like unload the file and do the thing.
I remember this. I know what you need. So when do you need to go see a myotherapist?
Well, obviously if you've got a soft tissue injury, right? If you've come off the court and sprained your ankle, we're a great place to start. If you've been moving house and you've lifted a box wrong and your back's hurting, great place to start. Even if you're starting a new job, or you're concerned about like certain pain that's been lingering for months and months, it's really beneficial to anyone really that comes through. Even if you haven't got like problems per se, preventative is always easier than cure, right?
True.
So coming in I've got patients that come in, they've started a new job, or they're fresh out of uni, and they're like, I've started a new sedentary job and I want to make sure that I don't get hunched posture over time, so we work on that. So it's really anyone and everyone, but I think it's more about like providing the awareness, because I think it's still up and coming, as it's been around for a little while, but I think it's people more gravitate towards physios and chiros because that's what's more well known, especially in the health insurance side of things.
Yeah, absolutely.
So it's just providing the awareness of like, hey, we're here, we can help.
I remember when I met you at a party and you told me you were a myotherapist, and I was like, oh,
what that?
Awesome. Yeah. I've never heard of that before.
Yeah.
That's really cool. And now I'm obsessed. And
yeah, of course. But then that's how it starts, like the curiosity, and then you sort of think, oh, I might try this, and then people like get hooked. So it's really cool.
Yeah, I can imagine, like you said, almost anyone could probably benefit from at least going and just having a chat.
Totally.
And talking about your work, your lifestyle, and I'm sure there are definitely habits that you could put in place to prevent injury or treat any pre-existing injuries as well.
Absolutely.
Very cool. You mentioned back pain in there before. Can we just briefly talk about back pain? Because I know this is something that affects so many people.
Totally, yeah.
I think everyone either has at some times or knows someone who struggles with back pain.
Absolutely.
And just to super generalize it, is it just lifting heavy things? Like, what's the main cause of back pain?
Well, it depends. Like, you've got different, like, sort of categories of lower back pain. So you've got something called idiopathic lower back pain, which is probably one of the most frustrating, because idiopathic means there's no sort of rhyme or reason. Like, you've got back pain for no...
It's just there.
It's just there.
Yeah.
Even on scans, it says nothing's wrong. You know, you're fine. You know, and that's probably the most frustrating and challenging. But I guess like the process is the same. So, you know, working on your core strength is really, really important, especially a muscle called the transverse abdominis, which is what I talk a lot about with clients that have any sort of back pain, disc problems, sciatica, generalized lower back pain, or lifting heavy things.
Yeah.
And they've suddenly felt a tweak in their back. I think that's very, very integral, because that muscle backs up onto the lower back muscle called the QL.
Yeah.
And when the TA is not working properly, the QL will take over that movement and really like make all the spine sort of compress and freeze, because it's protecting you. So working on your core is something I drill into my clients, and I'll be like, have you done your core exercises today? When people come in, but it honestly makes like the world of difference.
Yes. If you're one of those people that maybe just has a general a niggle sometimes, is there, like you said, maybe some like core exercises that
definitely. I mean, like it's a bit hard to explain like how to activate your TA via a podcast, but I mean, I guess you could, like, if you've got someone that you know that's a practitioner, you could ask them, you know, what's a TA, how to activate it, or you can like YouTube what a TA is and how to activate it. You could do that. It's also really important to, you know, if you're not doing any exercise, you know, to explore that, and you know, even like walking can activate your core to some degree. Pilates is very, very good as well. Having, you know, guided Pilates would be really, really helpful and preventative as well. In terms of like lifting things, like obviously always lifting with your legs and not your back, and trying to really brace your core before you go and do that. But I think education around the core, if you've got, like I said, a practitioner that you can go to for education around your core, that's probably like the biggest thing. Yeah.
That's probably the best answer, I think, is if you have some sort of back pain, maybe do something about it. Maybe talk to there's no like one size fits all solution. Yeah. But,
and you don't want, like, a lot of my clients will, and I'm guilty of this too, and I think everyone is, like, you don't want to whisper to become a scream with your back pain. Because people will have these little niggles, like my beautiful best friend, for example, who recently hurt her back really bad.
Yeah.
She'd hurt her back, I don't know, 2 or 3 years ago, originally moving and lifting a box, and we fixed it, and I said, you need to go do Pilates, because this will happen again if you don't. And she didn't.
Yeah.
And then she had a really bad flare up that lasted a little bit, so now she's really like, okay, I need to work on my core now to prevent this from happening again.
How many times do you need to injure your back to learn?
Yeah. But I think she's learned her lesson now. God bless her.
Are there any big challenges in your line of work? Anything you struggle with sort of day to day?
Oh, that's a good question. I think if I'm having like a hard day in my personal life, it's really hard to block that, and because I really make a point to be there for my clients and be really like receptive, and, you know, actively listen and really try to give them tangible advice about their condition, obviously, and we're here to listen to their personal life as well. But I think when you're touching someone, obviously a lot of issues come out, personal life, financial worries, like everything just comes out, and it's sometimes when you're not feeling mentally strong, that can be a lot on you. But I don't you'll let them, like, you know, you'll all see my poker face at the clinic, because I want to give people the time of day, you know, of course.
Yeah.
And that's like the most important thing to me, is to have clients have a voice and be listened and be heard.
That sounds incredible.
Yeah.
Do you have any general advice for listeners who might be struggling with some sort of pain or injury?
Yeah, I think, like, definitely go seek help, even if it is a niggle, because, you know, like I said, you don't want a niggle to become a scream. But I think if you can get moving in a safe way, like walking's always quite safe, generally speaking, and reducing those inflammatory factors as well. So the alcohol, the sugar, the gluten, all that sort of stuff obviously plays a role in inflammation. But I would strongly suggest to go see someone.
I have injured myself many times
in
the past. Yeah. And sometimes I've gone to see a physiotherapist or a doctor about it. But then there's been other times, pretty bad injuries, where I just trying to save maybe like $100 or a few $100s, and I'm like, it'll be fine.
It's hard.
You know, years later, regret.
Yeah, well, there you go.
If you injure yourself, go just get it checked. It's worth the money to prevent future pain and cost. Like the future cost is just
and I think like that's like what annoys me most about the industry is I think. And I'm hoping that this will change in time with the government. You know, the health insurance rebates are so little for myotherapy, and I would love to see them give more rebates, because I think people want to do it. They're just the financial strain holds them back a little bit. But I think when you're in so much pain, you're like, I don't care what it costs. I just want to be out of this pain, right?
Yeah, exactly.
But you don't do that until you're in that pain.
And then sometimes it can be late, or
it's never too late, I guess. But yeah, it's like you didn't have to put yourself through that. But I could totally understand the financial burden. So I'd love to see health insurance have more rebates in the future. I would love to see that.
Me too.
Yeah.
Well, maybe this discussion we're having now will lead to that.
Maybe we'll start a movement.
What about yourself? How did you get into myotherapy? What got you interested in the first place?
So I was a dancer from, I think, about 13, 14 to, I would say, 21. Dancing quite competitively.
What kind of dance?
Hip hop. So there's a lot of stomping. There's a lot of whiplash in your neck.
Okay.
And
it's rolling your body
around.
There's
a lot of whiplashing. And I remember I sprained my neck at least half a dozen times, at least. And I actually remember, like, I was sitting, like, on this couch just in this room, and I had an ice pack on my neck, and I was like, I cannot do this anymore. I cannot be in this pain anymore. So I went to a myotherapist, and I was just like, oh my God, like, what is this? And I think, how old would I have been? I think I was probably like 15, 16. And I was like, I always thought that a job was always a corporate job. There wasn't a job other than a 9 to 5, sitting at a desk. That's what you did with your life.
Yeah.
And I was like, oh, okay, there's other jobs like that are cooler, are funner than that. And so I loved that process of like how the myotherapist, helped me for one thing. And also like the process of I didn't have to sit at a desk and so that, and I sort of like, that was sort of on the back burner. And I originally, like when I graduated high school, I actually kept it on the back burner. Like I didn't even go into study with it. I actually went to study fashion buying and marketing. Because I have a very corporate brain. I don't have a health brain naturally. So I've actually had to work really, really hard to understand anatomy and understand how the body works, even more so than someone that's, I guess, naturally in the health realm.
Yeah.
So I did marketing and buying for a couple of years, and I remember sitting in class one day and going, I don't want to be here. I don't want to be here.
What am I doing?
What am I doing? So I literally looked up how to transfer into a remedial course and myotherapy course, and that was it. I just went in, I was like, this is me, this is my calling in life, and like I just knew, and I felt it in my bones or in my fascia.
That's such a good origin story. I love how you were like dancing, and then there was an injury, and you were helped by a myotherapist, and you were just like, wow, this is life-changing, I imagine.
Yeah, and it's so cool, like, because I've had those moments with clients, like as a practitioner, like they'll leave crying, like happy tears, and there was a guy that I was that I had a couple of weeks ago, and I've seen him for many years. He's so beautiful. And his daughter was getting married, and he'd hurt his back really bad and couldn't move walking into this session. And his daughter was getting married that weekend. And he was just like, I don't know what to do. How am I going to dance? How am I going to have my father-daughter dance? He walked out. He was literally dancing, like walking out, and he was like doing this. And it was the best. It was the best feeling. So I was like, he's going to have such a good time at that wedding. And he sent me photos from the wedding, and it was just it was so nice to be able to like give him that. So
that's incredible.
Yeah.
What do you do when you're not working? What do you do outside of myotherapy?
Well, like I said, I don't have a natural health brain. I have a business brain. So over the years with my own health issues, I've really like honed in on health stuff. So I deep dive and research, because I'm a bit of a nerd. I deep dive and research into, like, I'm really into gut health at the moment. I'm really into lymphedema work at the moment. Apparently I go to parties and meet podcasters.
True. It's always fun.
It's always fun. I love doing my own Pilates, practice what I preach.
Yeah.
Cooking, cleaning, because I'm Italian and that's what we do. We love to clean.
You mentioned the gut microbiome.
Yes.
I'm also super interested in this.
I'm obsessed.
I need to do an episode on that.
I will listen to it.
Someone who's a gut bacteria expert.
I have a practitioner. You can. I'll give her.
Oh, yeah?
Yeah, I actually do.
Awesome. I'm going to get back to you on that one.
Yeah, sure.
Are there any social media accounts that people could follow if they were sort of interested in muscle?
Yeah, definitely. Like, I'm obviously going to tag my own business that I work for, so BodyMotion Physiotherapies. Great place to work and to follow on Instagram. And there's also a really good one for like self lymph drainage, Dr. Perry Nickelston, so from Stop Chasing Pain. That's a really good one to like open your eyes and say, oh, okay, I can actually like self drain lymph, and because lymph is obviously integrated with pain as well. So that's a really cool one to follow, just to like get a better understanding of how like the body is so integrated and it really does all move as one and not isolated.
And that's something most people probably wouldn't think about. I mean, everyone knows about your vascular system, your blood vessels and everything, but people often forget about the lymph system, which also runs through your body, and
Absolutely.
It's super important, especially for your immune system.
Totally, yeah. And I think people forget about the lymph system because it doesn't have its own pump, so you need to manually help it out, which people forget. And apparently, like, I don't know how true this is, but apparently, because it's a very like evolving thing that we're still learning. Like, we only just learned recently that you've got a lymph system in your brain called the glymphatic system. So we've only just discovered that. So I think people forget that they need to, you know, drink water and move their lymph to help prevent disease and prevent pain, and whole other kettle of fish.
It is a whole other kettle of fish, but I just want to touch on this kettle of fish quickly. The lymphatic system runs through your body alongside your blood vessels, and it contains immune cells to protect you from infection, and it helps to get toxins and other bad things out of your body. But it doesn't have a pump, like your blood vessels. They have the heart, but lymph just kind of sits there. So to keep your lymph system working, you need to move your body, get plenty of exercise, drink lots of water, and use massage to get your lymph moving and get all of that bad stuff out of your body.
Any book recommendations? Anything you've been reading lately?
Yeah, I haven't been reading it recently, but it's a really, really good book for people who are just starting out, or if they want, you know, to learn more about the muscles and anatomy and how muscles work. It's called The Trail Guide to the Body. I think the man is Andrew Beal, and he explains things in really basic terms, you know, like I think I remember reading, like, when I was at uni, like, your rotator cuff can be strained by pulling a dog on a lead. So, and like, you know, really palpating, so feeling the muscles and how to feel them, understanding how that sort of works. That's a really, really good one for people starting out if they're interested.
I would say it sounds like anatomy or myotherapy for beginners.
Totally. It totally is. Yeah. And there's a really great app called Essential Anatomy, which is essentially that, and you can isolate the muscle and you can see the origin, insertion, action. So where it starts, where it finishes in the body, and the action of that muscle, which is really, really cool to see.
Very cool.
Yeah.
Incredible. Well, I've got some listener questions for you, if you're ready.
Of course.
But before that, each week here on Travelling Science, we make a donation to a charity of the guest's choosing. And this week, Elyse has chosen to make a donation to the Cancer Council, a charity which works across all areas of cancer, from research to prevention to treatment and support, and they won't stop until cancer does. So a donation has been made to the Cancer Council on behalf of Elyse, and if you'd like to make a donation to them as well, you certainly can. We'll put the link in the show notes just down below. That would be incredible, but for now, let's get into the listener questions. Natalie, I was wondering, coincidentally, if you have any advice for treating shoulder pain.
It is coincidental. It really depends on the shoulder pain, but I would say starting with icing, if the pain's been long standing, or if it's been recent, icing can be really beneficial in the first initial stages. So 20 minutes on, 20 minutes off. Ice is always safer than heat. I should probably throw that out there as well. If you're ever in doubt, ice it out.
Yeah. It's good to remember.
Yeah, it's a good one to remember. And some really basic pec stretching would actually be really beneficial, because when your rotator cuff is compromised, it tends to sort of rotate inward, which can grind the bursa a little bit. So doing some really basic pec stretching would be really helpful.
Okay.
I would also get her to be doing some isometric internal and external rotation, which is kind of like a little bit sciencey, but yeah, I'd probably be starting with the pec stretching and the icing, and if it doesn't go away, I'd probably be getting into some more rehab with physio or myo if she can.
Just quickly on that, does icing an injury help, say, weeks later, or is it really just like in the first during the early inflammation? It
can do. I haven't really seen like literature to say that it's helpful, but I've known that it to be helpful within my practice and within myself. So I would say yes. It's not going to be harmful to you to do that. Yeah. What would be harmful, not greatly harmful, but it just does prolong a lot of your issues, is using heat in the initial stages if it's not in using the correct manner.
Right.
Check
with your myotherapist on that one.
Yes.
But yeah, hope that helps your shoulder pain. Nat. A question from Yorkie. She was wondering if you ever have any patients with endometriosis. I don't know if that's anything you deal with.
Yeah, definitely.
Do you have any advice on something like that?
Yeah, definitely. I've got a few patients in my current list that have endo, and shout out to the endo warriors. It's such an awful condition. Mm. But, what we would do is, because all the muscles are so tight around that area, you are more prone to lower back pain and more prone to lower back injury. So I would be working on really mobilizing your hip flexors, so looking up hip mobility exercises to really open up that area. Okay. Getting regular treatments would probably really be beneficial for her, and obviously working on her TA as well. So working on your core strength would be really, really beneficial for her. And it would also help the lymphatic drain as well. So a part of endometriosis, you have to sort of help your detoxification systems as well. Yeah. So that would be helpful to get some lymph drainage in, and that would be through massage or through a self lymph release, dry body brushing, hot cold shower therapy, anything you can sort of do to help that detoxification happen a bit more.
Yeah, right. Yeah. That's some really good tips for Yorkie.
Yeah.
Thanks so much. Or anyone struggling with endometriosis. And one that we mentioned in the Instagram story, Blue Jim wanted to know what is lipodema and how might you treat it or help it.
Lipodema is really, really cool, but it's also really like annoying for people that have it. It's a bit of an asshole. It's a bit of an asshole disease.
Yeah.
So lipodema is basically a condition of the fat cells. So you and I, we have, as you know, in quotations, normal fat cells. So in an adolescent, we're sort of have like the same amount of fat cells that we're ever going to have going into life. If we put on weight or if we lose weight, those fat cells just get bigger and smaller. We don't accumulate more fat cells.
Okay.
But people with lipodema
Yeah.
accumulate more. They keep producing more. And you've probably seen it but not realised that you've seen it. So it's where people have like those wavy appearance of their legs. If one leg is bigger than the other, that can be a telltale sign as well.
Yeah, right.
The patients that have a very heavy foot, like heavy, they feel heavy within themselves and they can't sort of shift, and it's really, really hard for them to lose weight because it's not really like obesity per se. It's more this condition.
Excess fat cells.
Totally, yeah.
That just sounds super annoying.
Yeah, and it's nothing that you've done, and it's frustrating because a person with lipodema would probably go to a GP, and I've had patients go to GPs and they just say, oh, you're just overweight, you need to lose weight and eat less, and it's not really that sort of an issue.
Yeah.
So the way that we treat lipodema, so funnily enough, MLD, so manual lymphatic drainage, is like the heart and the main way that you treat it. So obviously lipodema is incurable. We can't cure it unless you do something super invasive, which I think only one surgeon does in Australia, is in really invasive liposuction and removing those fat cells, which obviously come with its own set of risks and financial constraints. So not everyone can do that, because I think the surgery for that's it's like 150 grand or something, like per session. So it's crazy. But as a myotherapist, we can do manual lymphatic drainage, so it's actually encouraging the lymphatic system to work better and to reduce that swelling and push it all out easier for the clients to be able to put their shoes on and to be able to walk around and feel a little bit freer, in combination with other things like compression stockings. So that really helps, and I've been really experimenting and using like other techniques to really help with lipodema patients. Like cupping is really, really helpful to break down that tissue and move it along.
Cupping is that treatment that you've probably seen. It looks pretty weird. It's like there's these weird booby-shaped cups on somebody's body, and they use negative pressure to suck up the skin under the cup. And it might seem like a trendy new age technique, but ancient texts have shown that cupping was used thousands of years ago by the ancient Egyptians in 1550 BC. You know, give or take a few centuries. But this technique can help with pain, inflammation, blood flow, and a variety of health problems.
But it's a really important modality to have in a lipodema patient's toolbox, because if they don't have lymphatic drainage, like their quality of life is so poor.
Well, that's lipodema.
That's
something
lipodema.
I didn't know about, but super interesting.
It's one of those ones again it's like the awareness is not quite there yet, but it's becoming.
Absolutely. Like now that you say it, I'm sure that I've seen that before, and I just never really
gelled. Yeah.
Incredible.
Yeah.
Well, thank you so much for answering those listener questions. Just had a couple there. And just to finish, if you're ready, we've got a lightning round.
I'm nervous.
You'll be fine. All right, the timer starts now. What's the most common issue or injury you see in your line of work?
The trend depends on the day, but I would say rotator cuff or neck.
If you could have done something completely different with your life, what do you think you would have done?
I probably would have done corporate board, but if we're talking like dream fantasy, like dancer, but honestly, like knowing what I know now, I probably would have been like doing what I'm doing now, obviously, or I would have been like an osteo or a sonographer even. But I think in another life, corporate or an astronaut I don't know.
Yeah, anything. Jeez.
Anything.
What do you love most about myotherapy?
I think like giving people like the voice of reason. I think like being, because you can get really stuck and really like caught up in your pain and go on a downward spiral. And I can say, no, we're gonna like this is how it's gonna be. This is what we're gonna do, and this is how you're gonna feel in a couple of weeks. And like them seeing that is like means the world. And I love the fact that we can get them out of tears and out of pain and get them back to normal life. That's my favorite thing.
It's incredible.
Yeah, and I also love stabbing people with needles.
Okay, two good reasons.
Two good reasons.
What about the worst part? What's your least favourite part about being a myotherapist?
I think the lack of awareness with, as far as the government health insurance sort of side is concerned. I think that's the most frustrating thing that I like about the industry.
Coincidental question again.
Yeah.
What do you think is the most commonly misunderstood thing about your job? Like when you tell people you're a myotherapist, what's the most common reaction?
Yeah, they're like, what's that? They sort of say, what's that? And then when I tell them, they're like, oh, I need one of those. Or, all right, like, they're probably, actually, that's what they most is like, oh, I need one of those. I'll come and see you.
Yeah.
Like that sort of, that's probably the most standard response.
And do you have a favorite muscle or condition to work on?
I love working on lipodema. I love doing lymphatic drainage because I think lymphatic drainage is like hot right now. A lot of like Hollywood people are going to lymphatic drainage places because like they want to try and fit in there, like their dress and look slimmer and all that sort of stuff. Not that that's what I do, but like it's just like the hot topic at the minute. My favorite muscle, that's a good one. I would have to say supraspinatus because it's very temperamental, but we need it. So it's the little muscle that lies in your rotator cuff, and it's probably the one you most commonly will tear. So it's very temperamental, but I love how you just had to do a shoulder roll.
I'm like, I got to take care of my shoulders so this doesn't happen.
Yeah. Yep.
Well, incredible. Elyse, thank you so much for coming on Traveling Science today. It's been incredible chatting with you all about this incredible field that not enough people know about, and hopefully some more people are feeling a little bit enlightened now.
Yeah.
Considering everything we have discussed here today, if you had one final piece of advice that you'd like to give to the listeners, something that they can take home and act on to improve their lives in some way, what would that piece of advice be? Walk
more. Everyone needs to walk more. People aren't walking enough. And I think people underestimate the power of walking and like how much it can do for your bones, your muscles, even your core and your neck. Like there were studies to show that neck pain can be reduced greatly by just walking. And core working on your core. And I guess, watching out for those inflammatory triggers and seek help if you need it. So don't wait on it.
So there you have it, legends. That was Elyse Zandegu, myotherapist, remedial therapist, muscle nerd, and dance queen. And I just love how determined she is to help people who are struggling with pain. I mean, pain is such a simple 4-letter word, but it's so complex. There's so many different causes, so many different types of pain. There's so many different factors, so many different treatments and solutions, which sometimes work and sometimes they don't. And sometimes treatments can be expensive or addictive, and chronic pain is often associated with mental health issues as well, which can be detrimental to the well-being of you or people that you really care about. So I just want to thank Elyse for coming on the show today and enlightening us, telling us all about the world of myotherapy. And hopefully you can use this information now or in the future to help you or your loved ones who might be injured or in pain. And visiting your local myotherapist just might be a life-changing event. So thank you so much to our guest today, Elyse Zandegu. And make sure you subscribe for more Traveling Science every single week. Also follow Traveling Science on Instagram, where you can send in your listener questions. And if you're more visually oriented, you can also check out the Traveling Scientist YouTube channel.
And finally, if you stick around to the end of the episode, I always leave you with a little secret. And this week's secret is that I mentioned in the episode I actually injured myself previously. That was when I was living in Japan. And one day I was out snowboarding and I lost concentration, took a tumble and crashed into a tree and really hurt my knee. But because of the language barrier and the fact that I was busy with work, I decided not to get it checked out. I figured it would just heal up fine. Well, now it's a year and a half later and I can still feel the pain in my knee, and I really wish I had done something about it at the time. So if you do hurt yourself, just go to a doctor, go see a physiotherapist, or even go see a myotherapist. Just get an expert to check it out. It's worth whatever little money they charge you because it'll save so much pain and cost in the future. So definitely get it checked out. Also, I'm currently traveling around Argentina and South America, which is really cool. Having a great time. I've been in Buenos Aires and Cordoba, checking out some of the national parks, and everything's going great. The only weird thing that's happened was a couple of days ago when I was walking through the street, somebody in broken English tried to sell me a baby. So that was interesting. Now, obviously I didn't take it, but I am thinking about it. Nah, not really. I'm enjoying this adventure around South America and looking forward to some awesome adventures. Thank you so much for listening, legends, and I'll catch you all next Science Sunday. Cheers.